Good afternoon, everybody. I'm Dr. Ali Makki, a pulmonologist at the Mediclinic City Hospital. I would like to talk to you today about the lung cancer as part of the awareness month of lung cancer. I would like to share my presentation. So yes, November is usually a lung cancer awareness month. Today is the 30th, the last day. And commonly when I have a talk about cancer, I start by a quick quiz. I wonder if you will be able to try it. Commonly people get at least one wrong. So just a short quiz, 4 questions, true and answer, true and false answers. First question, 10% of smokers go on to develop lung cancer. Second question, lung cancer is the leading cause of cancer-related death in men. Third question, lung cancer is the second leading cause of cancer-related death in women. And the last question, more than 80% of lung cancer patients are inoperable, meaning you can't offer them operation, and incurable at presentation. 4 simple questions, give you 1 minute to think about it and put your answers in your mind. So the answers actually are all correct, apart from third question, which actually lung cancer is the leading cause of cancer-related death in women. So it's cancer-related death in men and women as well. 8 to 10% of cancer of smokers go on to develop lung cancer, and indeed 80% or more of cancer patients are inoperable and incurable at presentation, meaning that they present late. So we just have a few points about basic principles about cancer. We know that cancer usually begins from a single mutated cell. Our body contains trillions of tiny cells, and we are always exposed to what we call carcinogens, meaning that agents which might affect the DNA. DNA is in the nucleus of the cell, which is responsible or control the division, the cell division. So the body cells are in continuous renewation and division. And we have this environmental thing which might affect the DNA, leading to damage in it. But the good thing that we have a system in our body, an immune system and lots of things which help to repair the DNA or remove that damage or affected cell from the body. But due to genetic factors, or as we go older and exposed to more of these carcinogens, some cells might escape this repair mechanism and then develop into cancer. So cancer develops when abnormal cells, this mutated cell, divide in an uncontrolled way and leading to tumors. Lung cancer in specific will develop when abnormal cells in the lung divide to form a tumor in the lung. We require like 30 divisions to occur before any symptoms might arise. So lung cancer might be a bit silent for a while until you have 30 divisions. 30 divisions is equivalent to 2 to the power 30. Initially, when I looked at this figure, I thought this will be a small number of cells. But if you have your calculator and put 2 to the power 30, that will give you a huge number of more than 1 billion cells. So, and that's obviously take a time. The cells divide every now and then. So it takes time. By the time you have symptoms, already the cancer has started a while ago. The incidence and mortality worldwide of cancer in general, in this graph from the WHO, breast cancer is the commonest cancer in women, and prostate used to be the commonest in men. If we see the blue lines, that's the indication of the incidence, but the yellow, the red lines is the mortality. So in the third row, it's the lung, and you can see also the number of lung cancer is much less than breast cancer, but the mortality is much higher, because in lung cancer, the presentation usually is late. In breast cancer, people present early, and we have them treated and cured in most cases. According to the WHO, in 2020, 2.2 million cases of cancer have occurred, and 1.8 million people died of lung cancer. So quite common, quite serious, huge percentage of people don't survive after developing lung cancer. Risk factors for cancer, obviously smoking. Smoking is the main cause of lung cancer. 80% of lung cancer related to smoking. And that might be easy to understand if you see this diagrams of the lungs of a smoker in the right side and the healthy lung. So this lung doesn't look healthy. Smoking, just by the way, will not affect the lungs only. It can affect the whole body, and it's responsible for cancers in different parts of the body, including the urinary tract. And if you can see from these pictures, the heart here in the smoker's lung is quite large, and it's not healthy heart. So smoking will not affect people in lung cancer only, but heart and other organs. Smoking tobacco expose person to 7,000 chemicals. So when you smoke one tobacco cigarettes contain this number of chemicals. It's known that 250 of these chemicals are harmful, and at least 69 of them can cause cancer. So serious stuff. Other factors which might increase the risk of person to develop lung cancer, for example, exposure to some type of dust, asbestos, silica, environmental gas like radon gas, which can be found in some places, especially underground areas or basements. Patients or some people might be more susceptible than others because of genetic factors. So if you have somebody with a cancer, or few of your family members got cancer, this will make you more susceptible because of genetic factors. We need to concentrate on secondhand smoking, as bad as smoking. So if you sit with somebody smoking or live with people who smoke, that's bad to your health as well. Pollution is another important factor. Just a quick note about smoking in UAE, which is quite common, especially among young males. The commonest age group who are smokers, 20 to 39. Most of people smoke cigarettes, 77%. Nowadays, we have huge number of people who smoke electronic cigarettes or vapes, which is an extra problem. Midwah is common as well. 15% smoke midwah. and shisha, very common as well. Few people smoke cigar. Whatever you smoke, it's bad. So there is no safe type of smoking. How does lung cancer present? As we mentioned, it usually presents late, and sometimes we might discover it by chance if somebody coming for X-ray for other reason, like for visa, and you find a lump like in the X-ray here, this white area here. This is in the middle here, this is the heart, but the lung usually black. And this is the CT scan, and you can see this white spot, which is the abnormal. So this might be cancer, might be something else, but when you find something like this, you will investigate and look for the cause. So this type of presentation is the lucky ones, which you might sort of diagnose early, and you might be able to cure the disease by surgery, for example. People commonly present with symptoms related to the lung cancer or the tumor itself, so the original tumor, which might cause cough or coughing up blood, shortness of breath, chest pain, stridor, sometimes might press on the nerves, affecting the voice box, giving hoarseness of voice. Other type of presentation, in a good percent, patient might present with metastatic spread. Metastatic spread meaning the tumor gone to somewhere else. So the initial abnormal cells started to grow and develop in the lung and then spread through either the bloodstream or the lymph vessels to other parts of the body. Like here, for example, this spread to the brain. Patient might come with headache, convulsions, fits, and here it spread to the liver. Patient might present with yellow discoloration, or we call it jaundice. Sometimes patient might present with symptoms related to hormones released from the cancer cells. Sometimes if we see somebody with what we call drumstick fingers here, or nails, this might, in some cases, might point towards lung cancer as the cause. So at the time of presentation or diagnosis, only 20% of patients have localized disease. 25% have regional spread, meaning that if it started in the left lung, might go to the lymph gland or extend in same area. In 55%, we have patients with distant spread, meaning the tumor already gone outside the lung to places like liver or brain. What we do when we suspect cancer, the main investigations include the imaging, and the primary thing, usually the X-ray, which is not very sensitive, the one in the left here. CT scan, obviously better, give cuts on the lung, so it will be several cuts and will show the lungs in more details. Like here, the lung I mentioned is black in colors, the heart in the middle and blood vessels. And this white spot is the suspicious lesion, we call it. And sometimes you might use the PET scan here. PET scan is like as if color TV in opposed to black and white TV. So this will take the material you inject in the vein will be taken by the more active cells, and we know the cancer cells are more active and metabolically consume substances. So this will light up, we call it, like a quite bright color. So this look like cancer. You will still not be sure what this lesion is, so usually you want to do a biopsy. And biopsy means taking a sample from that area or from that lesion. So we have different ways of doing it. We have CT-guided biopsy. The radiologist does it for us, and that's when they do CT scan. They look where they go. They put the needle through the chest wall and inside the lesion and take a sample that way. Sometimes we might use what we call bronchoscopy, which is like an endoscopy camera test with a scope. You pass it down and you go through the bronchial tubes, and this is abnormal here. This is a tumor, and you can put a needle through the scope itself and take a biopsy that way. Once you took your sample or biopsy, you send it to the histopathologist, people who look at the samples under the microscope, and they come back to you with the findings. So if they confirm that this is cancer, they will tell you what type of cancer. The only point we need to understand about this, that there is two important categories or types of lung cancer. We call them small cell lung cancer and non-small cell lung cancer. The commonest is non-small cell, about 80%, 15 to 20%, we call them small cell cancer. The different type of treatment, and usually the small cell is more aggressive and progress quicker. And important, after we confirm that this lesion is a cancer, and we know its type, then we do the process of staging. Staging meaning that you know how advanced, how aggressive the tumor, and you want to know the prognosis. You will tell the patient this cancer is quite advanced, the chance is small, or this is something you can cure. So we have stage 1 to stage 4, stage 2 and 3 in between. Stage 1 meaning that this is a small tumor localized to small area of the lung, like this spot, for example, and this can be treated by surgery. You can take it out and the cure rate is good. The patients who develop metastasis, meaning the disease gone somewhere else, like in the liver here or the brain here, other lung on this PET scan, stage 4, these patients cannot be offered surgery. We call them inoperable, and you might offer them other types of treatment. Why staging important? We mentioned that it will tell you how aggressive the disease and will tell you about the prognosis. Prognosis is very important because you will know that the chances of the patients good or bad. Stage 1, not too bad, still not perfect, but it's better than the other stages. Stage 4, if you can see here, this last line, we call it 5-year survival. Once patient diagnosed with cancer, then how, if he survived 5 years, this means good. That means he's cured. For 5 years, survival in stage 4, only 5%. Maybe with the new medicines we have now and the immunotherapy and some new drugs, the prognosis improved. This is a little bit old data. From 2020, we have better figures now with the newer drugs, but still stage 4 lung cancer is very bad news. And the other stages, stage 1 used to be like 60%, now we have better figures, maybe 70%. The treatment options depend on the stage and the type of the cancer, small cell, non-small cell. So the best type of treatment, obviously, and the chance of cure is if the patient can be offered surgery. So the surgeons can do small incisions and sort of keyhole surgery to take the tumor out, or a large incision here. Sometimes you might help it with radiotherapy as well to the tumor to make sure. But sometimes radiotherapy might be offered to patients with a more advanced cancer, like here. We have lots of patients will be offered chemotherapy or new therapy or the new what we call targeted therapy. So there is lots and lots of medications for lung cancer. So I think these points about the treatment and the prognosis of lung cancer. I think I just want small points about lung screening. Lung screening is offered in some places. For example, USA, they have a screening program like for breast screening for ladies. We do this mammograms in ladies older than certain age every year or every couple of years to detect if there is breast cancer early, to offer treatment early. Same like screening for prostate with a blood test for men. For lung cancer, we can do what we call low radiation CT scan. So small amount of radiation, because exposure to too much radiation might not be good as well, frequently. So this might be an option, but we have to select people who will be offered, because if you subject everybody to too much radiation, that might harm some of them. So this is from American sort of website, which they can calculate the risk of lung cancer, say in the next 6 years. So they take age and maybe the ethnic group, education. For some reason it affects the risk. Weight as well might affect. If somebody got COPD, chronic obstructive airway disease, which is a common disease of smokers. If somebody got history of cancer in the family or himself in other site, and smoking status obviously is very important. How many smokes, current smoker, former smoker. If you put all of them together, this is a young person with very little risks. So they calculated his risk of 0.1. So this is the type of person you will not offer screening for, no point. As long as he stops smoking, that's good enough. So on the other hand, if you find somebody like an older age with lots of risk factors, like he's got personal history of cancer, say he's had a throat cancer, or he's got a family history of lung cancer, he still smokes, he smoked lots of years, you calculate his risk of developing lung cancer within 6 years, and that's 43%. That's a huge number. So definitely this patient will need regular screening. So screening doesn't mean that you do CT scan and that's it. You might bring him next year for another CT scan, next year for another CT scan. So if somebody older and high risk, the risk of exposure to radiation is less than the benefit. So the benefit of diagnosing cancer early. Yeah. So what can you do, or what can we do to reduce our risk of developing lung cancer? Obvious thing, obviously don't smoke. If you smoke, stop smoking. Avoid secondhand smoke because it's as bad. Smoking of all types, avoid it as possible. Eat diet full of fruits and vegetables. Exercise regularly, and reduce exposure to outdoor and indoor pollution. And that's, I think, my presentation. Thank you for listening. Any questions?
Thank you so much, Doc. I will read out the questions for you. So the first question, Doc, is there are pretty lot of questions related to vaping. So the question is, can vaping impact lung lesser than tobacco or cigarette smoking?
Sorry, say it again. I didn't catch the question.
Yeah, so the question is, Doc, regarding vaping. Can vaping impact lung lesser than tobacco or cigarette smoking?
Can vaping affect the lungs less than cigarette smoking? So the question is vaping safer than cigarette smoking?
Correct, Doc. Correct. The question is vaping safer than tobacco or cigarette smoking?
Yes, I mean, this is a good question and very common question. Lots of people are asking about if vaping is safer. The answer, we don't know. It's likely. The feeling is that it is likely to be less risky. The tobacco smoking cigarettes, we mentioned there is 7,000 substances in them, 200 something serious or harmful. Definitely the number is much less in vaping, but still there is lots of substances there. And the problem is matter of time when we know how bad vaping is regarding if it's going to affect people regarding lung cancer. Yes, it's less risky, but it's not safe. Initially, when introduced, the idea was maybe to help people to stop smoking and then stop vaping. But the problem now is that we have people who started vaping and continue to smoke, so we have double devices they use.
Yes. Now, next question is related to shisha. How harmful is shisha? Does it make any difference from cigarette smoking?
Yes, shisha from although they say that it goes into the water, it's not nonsense that. It's not correct, and it's as harmful as cigarette smoking. And in fact, calculation-wise, 1 hour of shisha might be equivalent to 20 cigarettes, smoking 20 cigarettes. So it's the feeling is that it's more harmful. So if you smoke shisha every day, consider yourself as if you are smoking 20 cigarettes a day. And the more harm as well is the second-hand smoking here, because if you sit with other people, usually commonly people sit together and smoke shisha, and even you are not smoking shisha with them, but if you are in the same place, your exposure is similar. So yeah, shisha is worse than smoking cigarettes.
The next question is, can lung cancer be recovered after stage 3?
It is possible. Obviously, we mentioned the prognosis. Stage 3, say 5-year survival, like 20%. So this 20% actually is recovered, cured. Sometimes in rare situation might offer surgery, but commonly you combine other modalities, chemotherapy, immune therapy. As I mentioned, we have lots of new drugs which are quite effective, gene therapy including, and this targeted therapy, there is they try to analyze which mutation patients have, and there is drugs which target this mutation, and quite effective. So even for stage 4, you will have a small percentage, very tiny percentage, with people who recover.
Is there any possibility that cancer can come back after the surgery?
Yes, Yes, that's a common thing. It's once you have cancer, your risk of more cancer is there, but recurrence of the same cancer is definitely, this is why we keep following the patient with lung cancer after surgery. So patient with even stage 1, you treat with surgery, you will not discharge, but you will keep following up to 5 years with regular monitoring and scans, because your thoughts that it might come back.
Yeah, so we understand, Doc, the normal procedure of any kind of a cancer, which is the normal labs and ultrasounds and the PET scan, has to continue until the doctor would say, correct?
You mean the follow-up?
Yes, Doc.
Yes, commonly we follow up, yes, by CT scan or PET scan.
Yes. Doc, does the question is not clear. Based on the nicotine sticks and through heating, not burning, is it as harmful as cigarettes? It's
Which one?
IGOS. EGOS works based on nicotine sticks and through heating, not burning. Is it as harmful as sticks? So possibly it is a mode of
ICOS.
IGOS, yes.
ICOS, yes, this is just abbreviation. This is Morris. This is one of these big companies which produce this ICOS. I quit ordinary smoking, the abbreviation. It is through, yes, through heating the tobacco, heating the not the nicotine. Sorry. Yes, again, similar, same idea like electronic cigarettes, vaping, all of them. The idea is to deliver this nicotine, but you will not have only nicotine, you will have the other substances. And again, it is part of it will be harmful. Again, it's less harmful than cigarette smoking, the feeling, but we can't be sure. We can't be sure because it's still early days. These take years and years before you know.
What is the probability of getting lung cancer for negative smoker?
Non-smoker.
Yes.
Non-smoker, yes, up to 20%, 15 maybe to 20%, not related to smoking. And usually this type of one of the types of non-small cell lung cancer is more represented in this group of people. The small cell usually is a smoker thing. But obviously, there's, as we mentioned, the risk is include the exposure to different type of dusts, environmental factors, genetics, genes. So there is, yeah, you might see somebody without any risk at all and develop cancer just by luck.
Understood. How many years before we can tell that the how many years before you can tell that you are cancer free? So probably the question is that after someone who has survived a lung cancer, by what time can the person know that now the treatment is completed, completely cancer free? So that is something which you already answered, Doc, that the
Yes.
patient has to continue with the follow-up until the scans come clear, until the PET scan comes clear. Consequently, for a few years, the doctor then can say that the patient is free of the disease.
Yeah, this is a 5-year survival. We use it for the prognosis. So usually it's 5 years the time when you consider somebody free of cancer, and you can consider for discharge from follow-up.
Doc, there is another question which is not related to lungs. Again, I'm not sure if you would want to pick that question. Can jaundice cause cancer?
No, jaundice is a manifestation of problem in the liver. So that can be caused by different things, but cancer in the liver can cause jaundice. Obviously, there is lots of reasons why somebody might get jaundice, like hepatitis, like infection, different thing. But lung cancer can spread to the liver, and patients might present with jaundice. First thing, so you might have somebody just coming with you with jaundice or yellow discoloration, and you investigate, and then you discover this is actually lung cancer which has spread to the liver.
Yeah, so I understand it is a spreading, not the metastasis, which can happen from lung or any other cancer to the liver, but a jaundice cannot trigger cancer. Correct, doc? Is my understanding correct?
Yes, jaundice is just a manifestation or symptom of something going on in the liver.
So just to answer, doc, when we say a symptom of jaundice, it is an increased bilirubin level in the blood, correct, doc?
Yes, yes, yes.
Thank you. There is another question: which cancer is more harmful? So that I probably would want to tweak that question a little bit, doc. Is which is the type of cancer where you see the prognosis is much easier and better compared to the other type of cancer?
Type of cancer in general or lung cancer?
Doc, the question is basically which cancer is more harmful. So all the cancers are harmful and deadly if not treated. So which is the type of cancer which you feel? Is it breast cancer? Is it lung cancer or prostate cancer, where the prognosis can be very difficult? I'm sure this is something which is related to oncologist, but just in case if you want to pick that question.
The graph we gave earlier on cancer, I think it is going to answer your question, because its incidence, for example, here we said it's breast cancer, the blue line. There is lots of patients with this blue line. That's the incidence, but the deaths from that breast cancer is much small in comparison to the lung cancer, where you have the majority of patients with lung cancer will die. Majority, the red line here. If somebody got thyroid cancer because it's detected early, there is large number of thyroid cancer in blue, but very, very small will die. So the prognosis is very good for thyroid here, thyroid gland cancer. But in lung, it's very bad. So yes.
Doc, should we understand it is because the other type of cancer, which is like breast cancer, the breast can be resected off the body, still the body can function. If it is a thyroid can be removed off the body, still the body can function, just that the lungs function cannot be managed once resected, or there is no possibility of resection or removal of lungs, right?
It's mainly depend on when you discover it. The good thing, for example, about the thyroid is just in front of you in the neck here. So you can easily see it if it's becoming a large thyroid, and you can pick it up and sort of take it out or treat it before it goes somewhere else. Same like breast cancer. Ladies usually advised to check their breasts, and we have the mammograms, screening regularly. So these people will be diagnosed early before this disease goes to other parts of the body. So this is the area of the staging. So we discover this type of cancer at early stage, which you can treat. Lung cancer, early stage, not too bad, but it's difficult to detect lung cancer early because lots of time there is no symptoms until the cancer has spread. The lump or the tumor inside the lung might not give you symptoms unless it's in the middle, for example, or in one of the large bronchial tubes, you will give you a bit of cough. So it's just a matter of the delay usually in detecting or discovering the lung cancer. By the time you discover it, it's already spread. Because all of these other cancer, if it's stage 4, still the prognosis is not good.
Doc, the next question is, how often should lung cancer be checked for a smoker at an age after 30?
I'm not sure if I understood the question. Can you phrase it again?
The question, yeah, sure. The question is, how frequent a smoker should check for lung cancer once he or she is after 30 years of age?
This is a difficult question, obviously, about the screening, and you can try to, as I mentioned, you can try to predict or find a way of sort of assessing the risk of a person getting a cancer. So if somebody definitely at age of 30, you start screening him, by age of 50, you will have given him like 20 scans. That itself is dangerous. You give too many scans, that might actually be a risk for cancer itself. So you don't want to do that. You might consider screening somebody above age of 50 who is a heavy smoker and have history, for example, of cancer in the family. That might be a person who you will consider screening, and in that regard, you might screen every year or every couple of years. But obviously, the main thing is to try to convince a person to stop smoking. 30 of age, usually there is the risk is overcoming 5 years is not huge if you calculate it. But the earlier you stop smoking is better.
Doc, can you advise, does the PFT, the pulmonary function test, deteriorate for a smoker? Does the pulmonary function deteriorate for a person who smokes?
This, the pulmonary function or spirometry is very good test for smokers, and we recommend all smokers, say like people who smoke for 15 years or more, to get spirometry, because we have this condition, we call it COPD, or chronic obstructive airway disease. This is a very common thing in smokers, and patients might not have symptoms at all. Some people obviously might have smoker's cough, but breathing might not be affected. They might not feel breathless. But when you do this spirometry for them, or for, pulmonary function, you find already there is deterioration or drop in their spirometry figures. And this patient, you will tell them that this is already, you have signs of COPD. Because we know lots of people might smoke for 100 years without problems. It's a susceptibility thing. People are susceptible to damage. Some people might be a bit immune to the harmful effects. So unless you do this spirometry, you will not know if you have a problem or not. So it's a good test and simple test, easy test to do. Anybody can have it. It's not something with side effects.
So, Doc, that answers the question. Like someone who thinks want to screen themselves periodically, if they are a heavy smoker, maybe they can first consult a pulmonologist, do a pulmonary function test just to see if their lung capacity or the pulmonary function has deteriorated. Based on which they may want to go for the first further screening like scans if they want to avoid unnecessary scans, correct, Doc?
Yeah, I think it's two separate things because we have the smoking can affect the lung in different ways. One of them is causing lung cancer, but the other damage might be through this COPD, chronic obstructive airway disease. As well, it's not a good disease because it progresses and patients will become breathless with time. So you do the spirometry to detect for any evidence of COPD, but you might sort of try to find the risk of cancer for the patient and consider them for screening. That's a different thing. So screening for lung cancer, spirometry to look for COPD.
Doc, can you advise what are the high alarm signs for a patient to look for to consult the doctor immediately, thinking that it could be the initial symptoms of lung cancer?
I think all the symptoms we mentioned, if he started to develop symptoms which are persistent, especially cough. Cough is common in smokers in general, but if continue to have cough, definitely this person need to be seen. Any symptoms, I mean, shortness of breath, chest pain. The most worrying symptom is coughing up blood. So if somebody starts to cough up blood, we take this seriously. Commonly, coughing up blood is a serious sign. So this type of patient will have a bronchoscopy, what we've shown earlier, the camera test, will have a CT scan. So yes, all of these symptoms need to consult without delay.
Doc, how harmful is passive smoking? Does shisha smoking also have the passive smoking harms?
Passive smoking is quite harmful. Some people think of it as more harmful than smoking itself. People who smoke have, for example, a filter, which the smoke will go through the filter. But if you're sitting all the time, if your husband or wife smokes at home, all the time there is smoke in the place, that's harmful. That's harmful. So there is good number of patients who develop lung cancer just as a result of passive smoking.
Doc, is there any medical breakthrough which has come on the cancer treatment?
Sorry?
Is there a new medical breakthrough on cancer treatments?
Medical.
Any new medical trends or medical, treatment? I think right now what we are using is chemotherapy, radiotherapy, surgeries. That is.
Yeah.
So
Yeah,
think
definitely. For the last few years, as I mentioned, we have huge number of cancer medications new. Some of them we call them immune therapy, works with the immune system, so it stimulates the immune system in a way that it kills the cancer. So when you give chemotherapy, the medicine itself kills the cancer with lots of side effects because you kill the normal cells as well. So you give the patient lots of side effects. But these other type of medicines, the immune therapy, for example, your immune system will be doing the work. You have the gene therapy. There is this cancer which you can find the mutation or the problem in the cells which started the cancer, and you can target it that way. We call it gene therapy, targeted therapy. So you target the source, the cause of the cancer. The this sort of individualized type of treatment. In the past, we have a regime, fixed type of regime of mixture of chemotherapy, and anybody, for example, coming with small cell lung cancer, you will have this regime. Nowadays, we have these new medicines, and you try to find which suit which patient. That's through analyzing the exact nature of how the cancer developed and what type of mutation happened to the cells which started the cancer. So you target it that way. So yes, in the last 5 years, there is huge development. These days, we see more of patients with lung cancer stage 4 who are surviving for 5 years. In the past, once we see a patient with stage 4, we are hopeless. We say that there is nothing we can do. Now, even stage 4 lung cancer, there is good chance. Obviously, it's bad cancer, but still better than before.
Yeah, so just to brief, Doc, the new treatment regimen which has come in cancer treatment is immunotherapy. And what I understand, the difference between immunotherapy is that it's a kind of a immune treatment which is given, which identifies only the cancer cells, attacks it and kills it, versus chemotherapy destroys the fast growing cells, which can be cancerous, some can be non-cancerous. So that is how. Am I correct, Doc?
That's in a way, yes, you are correct. A little bit, a bit complicated for me. Even I'm not sort of oncologist. The number, as I said, is very large of these new medicines or new types of medicines. So for us as pulmonologists, we will not be able to know much about it. Usually, once we have our workup, diagnosis, staging of the disease, patients will be then move on to be treated by surgery, by the thoracic surgeons, for example, or oncologists who are cancer specialists who can give these cancer medicines, or radiotherapists who give radiation treatment.
We are running short of time, so maybe we can rush with, there are a few more questions. There's a question, what are the general precautions needed to follow, avoid lung cancer? I think the answer should be that quit smoking. That is the most important precaution.
Yes, as you mentioned, quit smoking, avoid passive smoking, don't sit with anybody who smokes, try to get people around you, stop smoking if possible, eat healthily, exercise a lot, and avoid exposure to a lot of pollution. Some places where there is radon gas, there is some kits maybe to check the amount of radon gas in the environment because they smell less like air. It has no taste, no smell. So this gas is a sort of radioactive, short-lived gas. Yeah, so these are things which people need to do.
Brings in another question, Doc. From an air perspective, the pollution perspective, where do we stand when it comes to UAE air and the nature of air compared to other countries? How polluted?
Yeah, definitely. Dubai is not, UAE is not one of the cleanest places, and it's in the middle. I mean, if you compare it with China, not too bad at all, but you compare it with Switzerland, it's very polluted. We have lots of buildings around here. We have huge number of four-wheel drive cars. The weather itself, the dusty environment. So the weather quality is, yeah, you can say is medium to bad.
Doc, there is another question. Can COPD be cured?
No, COPD can't be cured. Once you have COPD, the damage is done. The idea is to stop deterioration. So all the target will be to stop smoking because smoking damages the lung. As we go older, usually our lung capacity will drop gradually. If you smoke, it will drop like fourfold. So it's 4 times the normal level. So it's unfortunately not curable and lots of time progressive as long as somebody continues to smoke.
With most myth or to have confusion with this, can marijuana really regulate the cancer or tobacco?
Sorry, I didn't catch that.
So, Doc, so the question is, does marijuana regulate the cancer or tobacco, the harm from tobacco? So the question is marijuana a treatment for cancer?
Marijuana it's used in some places to control the pain, for example. It's I think it's good in some places for some specific reasons, but obviously it's got its harmful effect. Marijuana, hashish, you mean?
Yeah, so I think it is a regulated drug, so we may not be able to comment on the effects of it, neither the side effects. Doc, next question is, in case I don't have any symptom, and in that case, lung cancer testing required? So very important question, Doc. When it comes to breast cancer, prostate cancer, we do mention that do your periodic test after the age of 35 or 40, go for your periodic test. So what is the recommendation for lung cancer?
For lung cancer, the screening program is not well established in lots of places. There is a screening program, for example, in USA. In UAE, United Arab Emirates, in the government sector, I understand they have some sort of screening program for patients with risk factors like smokers, age of 50 and above. They get this limited or low dose CT scan. In the private sector, there is no as yet clear screening program. We tend to see the patients with some symptoms, and then you might proceed to do a CT scan if there is a high risk, meaning they are 50 or above with significant smoking history, and maybe other risk factors like personal history of cancer, family history of cancer, or presence of other chest problems like COPD. But yeah, we are seeing patients who come and concerned about the fact that they've been smokers and they are worried about cancer. In most cases, they will get at least an initial CT scan.
Understood, Doc. So I think to brief that because the incidence of lung cancer are more in smokers, it is considered the risk factors are more for smokers. So it's important someone who smokes very heavily, who had been smoking for years, it's important for them to test themselves early. It's important for them to quit smoking.
Yes.
Otherwise, the risk is much lesser unless you have any symptoms which you see. Unlike the other cancer, which is breast cancer, ovarian cancer, prostate cancer, where the risk factors are still not very established, where the chances of someone getting those cancers are anyone randomly can get without even they may have some family history. Other than that, there is no other risk factors established. So
Yes,
thank you so much, Doc. It was a very interesting session. We had a good number of questions coming in. In fact, I had to consolidate few of them together. Thank you so much for your time. Thanks everyone for joining today's session. Hope you enjoyed it. Thank you.
Thank you very much. Thanks.
Thanks, Doc.
Bye.